Thank you. I want also to thank the organization of giving me the honor to speak before you, and I thank you for being here. I'm going to talk about a special topic today that concerns a lot of people. Actually, is being burnout. So what to do against burnout. You have many patients, and maybe yourself, that at a certain moment had a sort of breakdown and they don't seem to recover. They don't recover from this burnout syndrome, and actually behind that it's because they are hormone deficient. And it's always not so easy. Even if you detect the hormone deficiencies, they seem to be intolerant to the intake of the hormones they desperately need to get back their energy, their health, and eventually even life expectancy. So let's go and look a little bit further in this hormone treatment of burnout syndrome. For me, burnout, especially the severe burnout syndromes, are mainly due to the hormone deficiencies that have been created either genetically, either just by excessive professional overwork. And so what are the causes? There is usually a prolonged stress or an acute stress, a severe trauma that has led to a sort of overproduction of hormones, but also to an overconsumption of hormones. And if there was a prolonged stress, after a certain time, the gland cannot do its work anymore. It keeps on overworking, but it will also tire easily, and even some lesions may come in, and it won't be able anymore for the rest of the life to make enough hormones for the person to feel well. So there will be a sort of prematurely aging. This can also be in a severe traumatic circumstance. It can be, for example, a car accident or some other major event. And that will give multiple hormone depletions and lead to a burnout that is resistant to psychotherapy, to antidepressant therapy. You can learn to live with it, but why learn to live it is when there's a solution to learn to live without it. And so here you have the typical sign. Your patient comes, he's burned out. And it's quite easy to discriminate these people. And there's a lot of books around, but they don't seem really to give another solution than improving your lifestyle, take professional work that is less demanding, etc. But you as a physician know how a profession can be so exciting. We have really chosen, I believe, one of the most exciting professions where we can, I would say, save people from a difficult situation, put them back in a good health situation. So we are often, as physicians, passionate about why would you work less if you can work even more after therapy. Of course, you still need to take some leisure and vacation, but what I really mean here is that there are solutions that are both healthy for the body and both also good economically for your profession. So when you look at the typical symptoms of burnout, you see, for example, here, there's difficulty of sleeping, fatigue and exhaustion, gastrointestinal problems, headache, but all these complaints actually are typical also for hormone deficiencies. When you look here, for example, anxiety, depression, aggression, being too irritable, too nervous, it can be linked to hormone deficits. And for example here, difficulty of sleeping and the fatigue and in particular the exhaustion is very typical for growth hormone deficiency. When you have a severe growth hormone deficiency, you will never anymore in your life be fit again if you don't take growth hormone treatment. You do not recover. You can stay 14 hours in your bed, you won't recover. Your sleep is superficial and you won't recover. Headaches is very typical for thyroid deficiency, and it goes away with thyroid hormones easily. Increased vulnerability to illnesses such as cold, flu, you get one infection after the other, very typical for thyroid hormone deficiency. The anxiety that they have, the fear that something's going to happen, although the situation may be not particularly stressful, well, that's typical for growth hormone deficiency. And when you look here at the guilt that they may feel in irritability, feelings of guilt and irritability is very typical of cortisol deficiency. the hormone deficiency that gives the most irritability is cortisol deficiency. Now, also the sense of helplessness.